Hello and welcome to Level 3 Health and Social Care, Unit 6, Stroke. So in this unit we're going to look at the problem of strokes, or to give them their correct name, CVA or cerebral vascular accident. And in this first part we're going to talk a little bit about the brain and how it works. And then we're going to look at the different types of CVA and the prevalence of it. Okay, so the word CVA and stroke might well be intertwined because it's the same thing. Stroke is a sort of common name, CVA is a more medical name, but you'll hear both of them. You'll probably see CVA in people's medical records, but often when professionals chat to each other, they may well sort of talk about she's had a stroke and that, but they're basically saying the same thing. Okay, so let's start by thinking about the brain. If you've done any biology classes previously, you might have some background about this. If not, it's worth doing a little bit of background reading on the brain, just to find an idea. I'm going to give you some information here, but you could always read a little bit wider as well. So the brain, as we probably know, is where we do our thinking, and all our senses are tied into our brain, and how we experience the world is really how the brain interprets all the stimulation it gets from the outside world. And that includes all our emotions, our problem solving skills, and our worrying skills, and our dreaming, and how we actually make our body work as well. All of that is done by the brain, really. It's not a very attractive thing. It's quite small and it's grey, and it's about the size of your two fists put together. So that's about the size of the brain. Okay, and it sits in a very hard, thick skull with membranes around it and fluid, and that's really there to protect it. So it's got the double protection of your very hard, bony skull, and then it sort of floats around a little bit in a bag of fluid, which is stops it sort of bouncing around and banging into the hard bits, which could cause it damage. So, how does the brain communicate? It's part of the nervous system, and together with the spinal cord, it makes up the central nervous system. And the brain connects to the nerves that travel throughout the body. And as you can see by the graphic here, they sort of move down from the brain, from the neck, down the spine, and then all the nerves come sort of off the spine and run along to different parts of your body. And the nerves from our senses, such as hearing, seeing, touch, they send signals to the brain to let the brain know that something's stimulating them or something sort of attracting their interest. And then the brain will send a signal back to the muscles telling them what they want them to do about it. Okay, so if it's like, if you put your hand over a fire, you'll get a stimulus coming up the nerves to the brain saying, ooh, this is hot, this feels unpleasant. And the brain will automatically send stimulus back down again, so to the muscle saying, move your hand away. Okay, but it's super quick. It happens much quicker than I could say it. Okay, so just be aware of that. The brain needs energy to function. Although it doesn't move, not like our legs and our arms and our muscles, but it does need a huge amount of energy because it's a very complex organism, really. And the energy the brain receives is from our blood and from all the different components of our blood. There's lots of blood vessels, therefore, running through the brain at all times. And if you have a look at the graphic here on the screen, you can see the amount of that. They're only the major blood vessels and arteries that are identified there. But there are tons and tons of smaller capillaries as well. But that's just a graphic of the main veins and arteries. And the brain uses about 20% of the body's energy. So 20% of your whole energy goes to keeping your brain functioning. Okay, so here are the different parts of the brain we have here. Have a look at the graphic here. And with each part of the brain, they have a purpose, really. It's three parts, really. You've got the cerebellum, the cerebrum, and right at the bottom, you've got the brainstem. And the biggest part is the cerebrum, which is the part of the brain that goes from here right across to the back. Okay, so again, have a look at the graphic there. And the large cerebrum is divided up into four lobes. You have the frontal lobe, you have the parietal lobe, you have the temporal lobe, which is on either side of your head, on your temples, hence the temporal lobe, and you have the occipital lobe, which is right at the back. Okay, and each lobe has a purpose, really. And if you have a look at the chart here, you can see the areas that these lobes and the cerebellum and the brainstem cover, really. So the frontal lobe is the lobe that really thinks about body movement, problem solving, speech, your intelligence, and your personality and your emotional responses. So in a healthy brain, that's what they should be doing. So if you have a look at the right side of the chart, the injured brain, you can see those areas when they become damaged, what sort of effect it could be. So there could be mood swings, changes in behavior, difficulty in problem solving, language issues, etc. Okay, so this chart is quite useful for you. So you need to spend a little bit of time sort of reading and revising this chart. The second lobe is the parietal lobe, which again, as I said, is in the middle, and that's where you have your spatial and visual perception, your sense of touch joins up here as well, temperature, pain reflectors are here. And there is also two strips that run across, which is the motor strip and the sensory strip, really. So the parietal lobe it's got a little bit at the front which is to do with motor activity, and then the sensory activity. Okay, the occipital lobe, think about the word occipital, think of the Latin occipital, you've got the orbit, the occipital bones here. So it's to do with vision. Okay, so any damage to the occipital lobe at the back, so if you fall and crack your head here, that's why you start seeing the Tweety birds and the stars, because it sort of affects your vision for a little while. You get blurred vision or you get strange things happening. And usually it settles down after your head injury improves. But if it's a major injury, then it might stick around and you could lose your sight. Okay. The temporal lobes, as I said, were on either side, just above your ears. Speech and language, memory, hearing, and sequencing. That's sort of putting your sentences together, you know, the right thing following the right thing, and general organizing of information. It's sort of a bit like your filing cabinet as well. So it helps, so it organizes your memories, really. So any damage to that could be memory loss, difficulty recognizing things, behavior changes, and definitely speech loss or speech affection, The cerebellum, which is the little lump just below, so it's below the occipital lobe, sort of right at the back, above your neck, right at the back here. It's a smaller area, and that's balance and coordination. Okay, so any damage to that, you have difficulty walking, tremors, you might have dizziness, or having trouble sort of picking things up, fine motor movements as well. And finally, the brainstem, which, as you can see, is a long thin strip which goes into the brain at the bottom here, so right at the top of your neck. But as we know, that strip sort of runs down your neck and down your spine and becomes the spinal cord. And the brainstem is really important because that's where it controls breathing, your heart rate, and your consciousness as well. So as you can imagine, any damage to the brainstem, say like if someone's been in a road traffic accident and has a fractured skull, one of the worst places to damage is really the brainstem, because you could, it will just affect your breathing, or it can control your heart. So that's probably one of the riskiest places, and people can, often die if they have damage to that area, or die quite quickly if the intervention isn't very, very fast. Okay. So, what is a stroke? It's a medical emergency that happens when the blood flow to your brain is interrupted. So without blood, your brain cells start to die, and this can cause serious symptoms, and it can leave you with a lasting disability, or it could unfortunately kill you. Okay, so remember, it's anywhere where the blood flow to your brain is interrupted, and it could be for a short time or it could be for a long time. And obviously, well, you can probably guess that the longer the time, the more chance of damage there is. Proper name is a cerebral vascular accident, as I said, or a CVA, and you'll often hear it called that or see that in medical records. There are three main types of stroke that we need to be aware of, really. There's the transient ischemic attack, which is often known as a TIA, the ischemic stroke, and a hemorrhagic stroke. Okay. And about 80%, 87% of strokes are actually ischemic. So that's probably the most common stroke that you're going to come across, but the other ones are around as well. Okay, let's look at the TIA first. Okay. So you may often have heard it known as a mini stroke. So it's a stroke, but in that sense it's not quite as serious as the other two. And it's where a blood flow to your brain is temporarily blocked, maybe just for a very short time. Blood starts to clot a little bit, and the symptoms will start to appear, but they can last for just a short time. So the interruption in the blood flow, it means it can't do some of its functioning properly. Often leads to symptoms such as slurred speech or a bit of weakness, maybe in one arm. But the blockage tends to sort of, it's a blood clot, but it breaks up, and therefore it moves on, and the blood supply returns, and there's no major damage. If it was a full stroke, it would be more serious. Some people look at TIAs as a warning because it's telling you that you might be prone to these sort of blood clots. So very often it's sort of, if you have a few, it's important to sort of discuss them with your GP as well. So what are they caused? How are they caused? It can be fat in the arteries that maybe has narrowed as you've got a bit older. And plaque forms. And this plaque is known as arterial sclerosis. But some things actually can speed this up. I mean, it is a natural aging process where the arteries become narrower and they become a little bit harder. But someone who smokes quite heavily, this can happen earlier because smoking actually causes this fatty plaque to develop as well. In fact, even more so. High blood pressure, if you just have high blood pressure, that can cause blood clots to sort of throw off. If you're obese, or if you have high cholesterol level, you can produce the fatty substances at a higher rate than normal. Excessive alcohol consumption can have that, because that can often drive your blood pressure up as well. And diabetes, it can be a side effect of someone who's had diabetes for a long time, that because they're creating a little bit more of these fatty substances than may be normal. There is a type of irregular heart rate called atrial fibrillation that can also cause a TIA, because the heart is beating not in a normal rhythm but a bit erratically, and that can cause it to form blood clots where it sits and then clots for a bit because it's not moving at the right pace. And these blood clots can sort of travel along, and then they get lodged when they get to a vessel where it's a bit too small for them. And often they break up and then go on their way. But for those little moments, it can cause the sort of effects of a stroke. So atrial fibrillation is something, very often it's a congenital disease, so something that we're born with, and you might not see it earlier on. You might find out a bit later on in life, or you might find out at medical examinations that you have atrial fibrillation, or you might find out because you're having palpitations and you go to the doctor. But it's usually something that people are born with, and it may get worse over time a little bit, but it can be managed quite well as well. So the TIA, as I said, is a temporary measure, but it can, if you start to have them too frequently, it can start to cause damage. But a real stroke is known as an ischemic attack, and it's got the same causes as the TIA, but it doesn't clear. It's more serious, and it doesn't clear. And this is the fatty deposits lining the vessel walls, coming from some of the causes that I just recently discussed, which is arteriosclerosis, and they can create two different types of obstruction. They can create a cerebral thrombosis, a blood clot. So if the fatty plaque, if you have a look in the picture, the fatty plaque narrows the artery so much the blood has trouble getting through, and it might get a bit clogged up, and that might form a blood clot, and then that doesn't break up like in the TIA, but stays there. And that can cause a stroke if it gets lodged in there in that artery picture, and the blood clot stays there, then it's a real problem. Or it's a cerebral embolism, and that's something that is also a blood clot, and it forms at another location in the circulatory system. So not particularly in the brain, but it can be in the heart or in the upper chest and in the neck area, and then part of that blood clot breaks off, and it starts traveling on its way through, and then it again reaches the vessels up here, which are just too small for it to pass through. So either way, really, these clots may break off from one part of the body and make their way towards the much smaller veins in the brain, and then they'll get stuck when the vein gets too small for it to get through, and that's where the stroke will happen. As I said, atrial fibrillation, if you've got atrial fibrillation and if you've been diagnosed with it, they will monitor you for things like this, because there is a risk because of this uneven movement of the heart, that it will cause clots to form. So they may well give people with atrial fibrillation may well have medication to keep their blood sort of thin and moving to avoid clots. Now, unlike a TIA, the blood clot is too big or too serious, and it will get stuck, and it won't go away without some sort of intervention or treatment. And during that time, you are having a stroke or a CVA. So I said atrial fibrillation is a heart condition that causes an irregular and often abnormally fast heart rate. Normal heart rate should be between 60 and 100 beats a minute when you're resting. You can measure your own heart rate if you want by checking your pulses in your wrist and your neck. So let's stop for a minute and see if we can check our pulse. Have a go at this. So to check your pulse, you should be sitting down for about 5 minutes. And if you've been watching this, you probably have been sitting down for about 5 minutes. Maybe don't smoke, or don't take a big slurp of coffee before you take your reading, because that can speed up your pulse. Okay. So hold your left hand out with your palm facing upwards. I'll have to take my watch off for this. With your palm facing upwards and your elbow slightly bent. And then place your index and middle finger, okay, of your right hand onto your left wrist at the base of the thumb between the wrists. So here, okay, and the tendon attached to the thumb. Have your watch on the side. Use the second hand of your clock or your watch and count the number, or you can do it with your phone, of course. Count the number of beats for 30 seconds and then double it, and you know how many beats per minute is. As I said, a normal heart rate should be between 60 to 100. Lots of us are between 70 to 80, tends to be what we normally are. If someone's got atrial fibrillation, then their pulse is probably over 100, and the beats are erratic, and you can feel like that. It's not a slow, steady pulse. It's like, so don't worry too much about that. If if you do find that you're getting high readings, you might want to just chill out and go and sit down for a bit and try it again. But if you are concerned, you can always go and see your GP. Okay, so we talked a bit about ischemic stroke, which is really the most common stroke. Most strokes are ischemic strokes. But another stroke that you can get is a hemorrhagic stroke, okay? And this is a little bit different. It's when a blood vessel in the brain ruptures or breaks, and then blood spills out into the tissues around it. So if you have a look at my graphic here, you've got a normal artery, and then the artery wall gets weakened and starts to get a bit thin, and then sort of swells out, blows out. This is why it looks a bit pregnant really in that picture. And if it keeps swelling and swelling, eventually it pops, and the blood that's running in that artery sort of floods out into the area, really. There are three main types of hemorrhagic stroke. The first one is an aneurysm. You've probably heard about people having aneurysms. So, and that's really what I'm showing you in the graphic. So the weakened blood vessel, it sort of swells out like a balloon, and then it might pop. The other is an arteriovenous malformation, and these are blood vessels which have been formed abnormally. So sometimes we don't know about these. Again, we might have had them from birth, and as you get older, you put a bit more pressure on them, and then they might rupture. So they might have just formed with too thin a wall, or some sort of weakness in the wall, or they might just pop. And lastly, very high blood pressure, untreated high blood pressure, can cause the very small blood vessels in the brain to weaken, because the blood is sort of pulsing. There's the vein, and the blood is pulsing through the vein at such an amount, it actually just causes it to stretch and pop, because it's too much pressure on it. It's a bit like if you're pumping up a balloon and you get past that point where the balloon is stretched as much as it wants to be, and you keep pumping it up a bit more, and the balloon goes pop. So that's what can happen when you've got very high blood pressure. That's why we take medicine for high blood pressure, to avoid that risk of it popping the small arteries in the brain, and that would cause a bleed in the brain as well. So these strokes are about blood leaving the veins, not, the ischemic is about a blood clotting in the vein, but it stays in the vein, and it sort of it stops blood getting where it should get in that sense, so it weakens it. This is about blood, blood vessel popping and blood flooding areas of the brain where it shouldn't be. Okay. Here's a little graph for you, number of deaths from stroke in England and Wales, 2019 by gender and age. And you can see that the older we get, the more the risk of stroke is. You can also see in this graphic that women have a much higher ratio in the very late years, in the 85 and over. You see they're fairly even, as you can see, until you get to 85 years and over. Then all of a sudden many more women are having strokes than men. And the reason is that's a bit of a sort of dodgy statistic, really. It doesn't mean to say that the moment you get to 85, there's much more chance of you having a stroke than your husband. It's basically because more women live over 85 than men do. So it's a bit of an imbalanced statistic. And the reason there are more women having strokes in there is because there's more of them around than there is men over 85. So that's why in the other years it's a bit more even, and then it becomes imbalanced. So remember that, and if you're explaining the statistics of stroke, sort of bear that in mind. Okay, here's another little graphic for you to see gender adjusted incidence rates by year. A is ischemic stroke, B is hemorrhagic. So I think A is the blue one. Oh no, sorry. A is the top chart and B is the next chart. Males are blue, females are red. So it doesn't matter which type of stroke. As you can see, there are high points and low points. Around the world, the lighter blue colours are the countries where stroke is much lower. So the bluier it is, the lower the risk of stroke. The yellowy countries are sort of the higher ones. The greens are the ones in the middle. So Europe, most of Europe, North America, lots of Scandinavia. But if you have a look at the big yellow part, that's Russia and China. They're sort of in the middle. And then strangely dotted around, there's some quite blue ones. If you look at Africa, it's all blue really. So stroke isn't there on the lower end of stroke incidence. And if you look at Indonesia, Malaysia, they're all on the lower end, right down to Australia there. They're definitely on the lower end as well. So stroke is not that so prevalent there. And we can probably equate that probably to the way people eat very often. So the sort of food that people eat as well, because the countries where it's higher, as you can see, like North America, Europe, Russia, China, it's much more processed food as well. So that's worth looking into. You can see these tiny countries that are dark red that are absolutely the worst. And that is Latvia and Lithuania, two Eastern European countries that have the highest prevalence of stroke in the world. And my husband's from Latvia. My husband's a Latvian, so I constantly joke with him about that. And that's very much down to their diet, I think, because they use huge amount of dairy produce, lots and lots of fatty meats as well. So probably not the healthiest of diets. But it'd be interesting to do a bit wider research, but I think the stroke prevalence is very much to do with diet. Might be interesting to judge the rates of smoking in these countries as well. I don't know. We could have a look at that maybe, or maybe you could do that as a piece of interested research. Anyway, that's the end of the slide. So we've talked a little bit about the types of CVA. That's important for you to know. And we've talked about the prevalence of CVA. Okay, so you can use these statistics to quote. So that's the end of the first part of your first week. Okay, thanks. I'll see you again.